Good afternoon, ladies and gentlemen. Welcome to join this section. My name is Hsiu-Ju Chang. My current position is Dean and Professor, College of Nursing, NYCU. It's my great honor to share with you the DNP program in NYCU. The content of my presentation will include briefly review DNP program in the USA and its advances, then overview of NYCU and the College of Nursing, including our DNP program. This morning, Professor Rosemary has shared with us several important concepts for DNP program, such as task force recommendation, implementation, progress and trends, and positive outcome in the USA. So here I just would like to briefly share with you some of the background influencing the development of DNP program in the USA. The healthcare system is getting more complicated, and this is a worldwide trend. So the future of healthcare will require new practice models to deliver quality care. There are several factors and trends that will require the insight of healthcare leaders at all levels, including reduced operating budgets, higher patient deductibles, a focus on quality care and patient safety, advances in technology, and sustainable and cost-effective care. At the forefront of this nursing transformation should be advanced practice nurses, which practicing doctorates who can not only improve practice efficiency, but are prepared to function as change agents in complex healthcare environments. The skills and competencies necessary for practice doctorates have prepared advanced practice nurses for process improvement initiatives, quality care, and evidence-based practice transformation, and all of which are very important key to emerging trends in healthcare. One way to address this changing healthcare landscape is to adopt new practice models to provide quality care. And these practice models include increasing the number of advanced practice nurses who have demonstrated efficient, innovative, and quality patient care. According to the Institute of Medicine report released in 2011, nursing is well positioned to lead innovative strategies to improve healthcare delivery if their practice reflects their educational training. In addition, as nurses gain higher levels of education, such as the Doctor of Practice, the leadership competencies embedded throughout the curriculum help to prepare nurses to lead the implementation of change in a collaborative environment. While the role of the Doctor of Nursing Practice is in its infancy, the DNP prepared advanced practice nurses has the ability to influence new practice models and provide high-quality care. DNP have been described as visionary leaders for the practice of nursing, and due to the nursing shortage and state of the healthcare system, the DNP has evolved in response to the need of the practice setting. In 2004, the American Association of Colleges of Nursing adopted a goal that by 2015, Preparation for professional nursing practice roles should occur at the doctoral level. As you can see from the figure on the screen, from 2007 to 2019, the number of PhD programs in USA increasing very slowly. On the contrary, the number of DNP programs is increasing very dramatically. Until 2021, there are 407 DNP programs are currently enrolling students at schools of nursing nationwide, and an additional 106 new DNP programs are in the planning stages. DNP programs are now available in all 50 states plus the District of Columbia. In Asian countries, nursing scholars may be more familiar with PhD program, since PhD programs are available in many Asian countries. However, only very few countries in Asia have DNP program. So next, I'd like to take a few minutes talking about the differences between DNP and PhD in nursing program. DNP is designed for those in direct clinical practice and areas to support clinical practice. And PhD is designed to provide skills for scientific investigation. The goal for DNP is to provide leadership for evidence-based practice and to apply and translate research into practice. The goal for PhD is to conduct or generate new knowledge that can be applied to practice and advance the theoretical foundation of nursing and healthcare globally. DNP program emphasize preparing experts in specialized advanced practice nursing, and PhD program emphasize preparing nurse scientists and scholars. The outcome for DNP is leadership and clinical expertise in the practice area. And for PhD, the outcome is nurse scientists prepared for a career in research in academia or other research-intensive environment. Regarding the hallmark, for DNP, it is intensive hands-on immersion and mentoring with expert clinical faculty. And for PhD, it is to engage in an intensive guided research experience with faculty investigators to build the foundation for research program. The final project may vary in different universities in different countries. Generally speaking, for DNP program, it could be a practice application-oriented scholarly capstone inquiry, and for PhD, it could be dissertation-based original research. As mentioned before, the number of DNP program is increasing in the USA, and you may be curious about how many DNP programs are available in Asia countries. Some of the members of the EFONs investigated doctoral nursing education in East and Southeast Asia. So as you can see from the table on the screen, many Asian countries did have PhD program. For example, Japan, Malaysia, mainland China, and South Korea, including Taiwan. However, very few countries have DNP program. Until 2017 in May, only Hong Kong, Thailand, Malaysia, and the Philippines have DNP programs. In Taiwan, the College of Nursing at NYCU established the first DNP program in 2018 and started an enrollment. And we didn't catch up with the survey, so that is why the number of DNP program in Taiwan is 0. This is another way to demonstrate the results of the survey for your reference. And this is the paper to show the results in the previous slide. In the paper, the author also showed other information like students' experiences and satisfaction. As mentioned before, the College of Nursing at NYCU started preparing for the first DNP program in Taiwan in 2015 and started enrolling students in 2018. And this year we are going to enter the 6th enrollment. Before introducing our DNP program, I'd like to introduce a little about our university. National Yangming Jiaotong University was created in 2021 through the merger of 2 universities. They are National Yangming University and National Jiaotong University. Currently, we have 9 campuses, 19 colleges, and 75 university and college level research centers. Although we have 9 campuses, most of our faculty and students are concentrated in the Yangming and Jiaotong campuses. Yangming campus focused on biomedical research, and the Jiaotong campus focused on electronic communication research, and both were top-tier universities in Taiwan. The NYCU comprised many colleges including artificial intelligence and green energy, biological science and technology, computer science, medicine and nursing, etc. So please feel free to visit our website to get more information. College of Nursing is located in Yangming campus. Our college has 2 college-level research centers, JBI Center and Efficient Smart Care Research Center. And for teaching program, we have Department of Nursing, Institute of Clinical Nursing, and Institute of Community Health Care. DNP is one of the programs in Institute of Clinical Nursing. The director is Professor Hsiu-Ju Chang. She is the moderator of this section. For the DNP program, the major source of the DNP students was from clinical nursing specialist and nurse practitioner trained background. Although our college is not a very big college, but around 3/4 of the faculty are professors, so our faculty structure is quite stable. Each year, the total number of students from different programs is around 439, and around 60% of our students are Master, PhD, and DNP students. For DNP program, we enroll 5 students each year, and students who obtain a DNP degree are eligible to apply for accreditation as an assistant professor because it meets the requirements for doctoral degree under the regulation made by Ministry of Education in Taiwan. The eligibility for application includes those with a nursing-related master's degree, licensed nurse, having at least 5 years of nursing clinical experience, and currently engaged in clinical practice. The applicants need to submit an evidence translation or practice quality improvement plan for the committee to review. The background and needs to support the development of the DNP program in Taiwan include advanced knowledge in clinical care setting has been developing very rapidly. And because of social cultural change and advances in medical technology, increased diversity of caregiving situations, and the complexity of patient care have been critically impacting the healthcare system in Taiwan. And this factor result in a lack of clinically oriented doctorate specialists in various industrial, governmental, and academic fields. The philosophy for our college to build up the DNP program are responding to the healthcare environment demand, cultivating top clinical leadership and scientific nursing talent, establishing cross-disciplinary collaboration with domestic and international schools and hospitals, deepening clinical evidence-based care and international mobility. And here are the core competencies in DNP program. Very important competency specific to DNP program is evidence-based translation and application. And in order to meet the demand of complicated healthcare system, DNP students also require the competencies of humanities application, integration of practice, independent nursing care, leadership, and scientific basis. We also hope the DNP program can reach some goals, building an evidence-based and humanistic model of care, improving clinical practice, and promoting population health, translating evidence-based knowledge in clinical practice, and integrated application of clinical capabilities. Those are very important goals for our DNP program. The total number of credits for graduation is 40. We also categorized the graduation credits into 5 categories. They are core professional curriculum, clinical nursing professional curriculum, advanced clinical nursing practicum, elective courses, and practice doctoral project. And this table shows some specific courses for different curriculum for your references. Generally, if there is no accident happens for students, our student can complete the core professional curriculum, clinical nursing professional curriculum, and practicum in 2 years. Then they can prepare their proposal and final oral defense. And here are some guidelines for practicum courses. For the practicum, we collaborated with some physicians and nurse practitioners in hospital. The Taipei Veterans General Hospital is one of the largest medical systems in Taiwan, and it is very close to our Yangming campus. We also have several collaborated hospitals. The ratio of clinical preceptor is 4 students, 1 physician, and 2 advanced practice nurse. And for the advanced nursing care practicum, by the end of the internship, each student will have cared for at least 10 medical and surgical inpatients. The second stage of practicum is professional field nursing care practicum. By the end of the internship, each student will have cared for at least 10 inpatients commonly seen in a specific area, for example, oncology or family medicine, in order to develop the competencies required for advanced nursing in a specific area. The third stage of practicum is development of evidence-based practice for enhancing population health. Students will be able to use assessment skills to identify family and community health issues in their cases. They have to think critically and systematically to conduct comparative gap analysis, use empirical evidence, and translate concepts and theories to develop and lead improvement program. So this is so-called DNP project. The final stage of practicum is clinical evidence-based intervention and evaluation practicum. The students are required to continue to implement and evaluate their DNP project. Although our DNP program is the first and the only one in Taiwan, we are still in the stage of infancy. So the future direction includes many perspectives to go. For example, we need to evaluate our courses to see if they meet the core competencies. We also need to cultivate more faculty with DNP or NP trained backgrounds to train our students. Collaborating with clinical specialists is also very important to upgrade the competencies of our students and faculty. We are also trying to connect more international resources to send our students to get more international experiences. And this summer, a group of faculty and students are going to go to Case Western Reserve University in the USA for a short-term international practicum. Thank you very much for your attention. The director of the DNP program, Professor Hsiu-Ju Chang, is here, and a very important contributor to initiate the DNP program, Professor Mu Pei-fen, is also here. So if you have any questions or suggestions, we three can answer your question. Thank you very much.